Welcome back to Her Perspective. We've been having an interesting discussion on the topic dealing with grief. Dr. Grace Kelly, chairperson of the Department of Behavioral and Social Sciences at Northern Caribbean University, and Ruby Redway. She serves as ward sister for the Mandeville Regional Hospital. They've been sharing their experiences and just pretty much helping us to understand a little bit more about this thing called the grieving process and how to deal with it. Ruby was sharing her story with us, but right now, Dr. Kelly, we want to find out what are some of the psychological and the physiological changes that may occur while grieving.
Okay, on a psychological level, you'll find that persons may experience memory loss.
Wow.
They may become sad, they may become depressed. You will find that they sometimes have issues with concentration. And as I mentioned earlier, you may be heading to church, and because you're familiar, picking up someone on the way, and that is a person who you might have lost, you may find yourself detouring. So those are some of the things that can happen. Severe depression, if the grief becomes pathological, then you'll find that the person is unable to concentrate, not only because they experiencing memory loss, but because they are hiding themselves behind something else. And they block the memory of the person or the thing that has caused the pain to such an extent that it affects them psychologically, and to the extent that some persons can actually lose their mind. They can end up being deranged and needing psychotherapy and also other psychological assistance to get back to the normal state. You find physiologically, you find changes in terms of sleeplessness.
Habits.
They have issues with either oversleeping or not sleeping enough. You have issues with eating, your appetite change. Also, behaviorally is a behavior change, a mix, a combo between the physiological and psychological, because it's what's happening in the mind that affects the behavior pattern. And so people who are very angry, they can redirect that anger, so they get into tantrums and they become bullies and so on, because they are trying to compensate for something. You find, though, also that with the kind of stress and depression that comes with the grief, there are other severe physiological changes where persons can end up getting cancer, cirrhosis of the liver, and all those kinds of
as a result of the stress.
As a result of the stress and the impact that it has on the body. And there are some pseudo sicknesses that occur.
That's that big word, Dr. Kelly. Great.
All right. You feel as if you have a certain illness, but in fact you don't. And especially when, all right, say for example, someone dies as a result of cancer of the breast or whatever. You grieving, you start feeling the pains, and you are sure that you have the same. And so sometimes the symptoms that that person had, you start having it, but the bottom line is it's just in your thoughts. So,
Dr. Kelly, that means you're right now explaining something that happened to me. My best friend died, and she just dropped down one Saturday morning. And I was driving with my husband, just thinking about it, and I started to hyperventilate. I couldn't breathe because I was imagining, in fact, I was saying to myself, I should have died because I'm sick with, I have a heart condition. And I'm saying I should have died, and healthy person as far as I know, to this day I can't figure out how she died. And she, so I started thinking about how she died. And I just couldn't breathe, and I had to ask my husband to stop. He gave me a bag, and I started, and I calmed down, and so I just was diagnosed Addis.
Right.
Yes,
yes,
because it tells you that you grieve. Each of us, we grieve in different ways.
Different ways.
Tell me something, Grace. Does grieving have a length, a duration? If I lose a loved one, can you tell me when my grieving process is supposed to end by? Is it supposed to go over a particular length of period?
There's not a prescription for that. You're not, the grieving, as was mentioned earlier, it's a process. Normal period of grief, say 6, 12, 18 weeks, in terms of the severe impact, and that could be starting after the burial, where there's a sense of closure to realize that the person has actually gone. But you will realize some literature, and also the psychotherapists, counselors, and psychologists will tell you, you cannot put any limit, because whereas you may grieve for a period of time, the other person has an extended period of grief because of the closeness of the relationship and the other things that it affects in their life. What is necessary is that you should not push the person through the process and say, time to get over it, man.
Or I understand. That's a famous
no,
saying.
you cannot.
I understand what you're going through.
You cannot do that.
Or God knows.
No, that's a different. That's a different dimension we are moving into. But for right now, I want to complete this aspect about the timeline. Because what happens is that if you continue, say, 6 months and beyond, and the same severity of pain that you experienced when you first heard of the loss, if it continues, then you are in trouble within the context. So it might be moving from what we call normal to pathological grief. And so the normal grief is something that someone, a friend, you can talk about it. You can talk with a counselor about it. But when it becomes pathological, where the person is unable to even accept, even for years, even accept that the loss has happened or the hurt has happened, that is something where you'll have to get assistance now from psychotherapists and other persons to provide that long-term support for that individual.
But the person has to want it.
The person has to want it, but sometimes they may not know that they need it. So that is why you need to have support.
Support
so
systems.
Persons, when they observe your change in behavioral patterns, like withdrawal also is another sign of grieving, and them not being able to accept that the person has died, and they are speaking as if the person is still here. And what some persons do, they pretend. So if they are in the living room, they pretend as if the person is still there in the bedroom and somewhere else, because they do not want to face the reality of death. When those things happen, it is really something that one has to focus on and get some help.
It's amazing that, well, you mentioned earlier in the program that one does not necessarily grieve only because of the loss of a loved one. You can grieve for many, once you've experienced some sort of a loss, right? Once there is hurt or pain. But many times I think we probably substitute grieving for depression in our context sometimes. Losing a job, for example, and one is going through the different stages of the grieving process. We don't necessarily call it grief. How important is education in this context then?
It's extremely important, because let's say some of the symptoms that we mentioned earlier, some of them may be for real. So I, as a counselor, cannot look at the client and say, because you're having those symptoms, as if you're having a heart attack or if you're having lung cancer, however you determine that. It is not in my portfolio to rule that out. So that is why it's important that you do consultations. So you send the person to a medical practitioner and if all those symptoms produces a result that you can rule out the kind of diagnosis that one would have anticipated, then you could say that it could possibly be as a result of the grief and the depression, because there's a very thin line between the two, the feeling and the reality of what is happening. So we have to be careful, and that is why we, in the health profession, helping profession, you don't just be the individual, only one person relating to a severe situation like that. We also need to be very careful not to cause the person to feel as if what they are doing is so abnormal. People need to be given permission.
In any way they choose.
Any way to express their grief and their hurt. They need to be given permission, and they need to be supported through the process. And not pushed through the process.
As you talk about support, you spoke about promises helping you through, but was there a good support, or is there support system for you?
Of course. Dr. Kelly was there for me. And I have other friends in church and at my workplace.
Very good.
So I had good support. And as family members, we try to support each other.
How important is that, Grace?
It is extremely important because support, okay, when one is going through the grieving process, there is a time when you move from the denial right down to despair. There is anger, there is a feeling of resentment and all of that, and the shock and the guilt and so on. And then it moves to the lower level where there is depression.
Okay.
At that time, I learned once that, well, I heard someone define it this way, that when you get to that stage and a feeling of despair, despair is an acknowledgement that there is no God, or a realization that there is no God. When someone is hurting and they are in dark despair, that is a time that they need comfort. They need someone to support them.
Not a sermon.
No, they do not need a sermon. They just need somebody to be there to understand, to interpret what's happening with them. And the interpretation doesn't mean you're going to say, but Lorraine, how come you don't cry, you know, you're crying or you're bawling as if you don't have any hope or those kind of things. It doesn't mean that. Yeah. It doesn't mean get over it. It does not mean, okay, it will pass away. No, it's just being there to support the person, to appreciate and understand what is happening. And now, at that time, they start now moving into a different dimension, moving up the ladder until they get to the stage where we recognize as a new normal. They adapt to what's happening. They appreciate what's happening to them. And in a bit, I could share with you more specifics on that in terms of, because there's a chart and there are some specific terminologies that I would love to refer to.
Sure. We have a break soon, but in a couple of seconds, Grace, how different is it, or how difficult is it for one who is a public figure, you know, going through that grieving process? Somebody who's known by many Jamaicans.
It can be extremely difficult if the culture does not appreciate and accept the need for grief. And I'm saying that because, say, for example, when one is grieving, their thinking is disturbed. Their ability to function on their job is going to be affected. And there is one thing that I would recommend in some cases: do not discuss your private issues and your grief issues with your immediate boss and those kind of persons. And especially you being a public figure, how do you display this kind of hurt? If I'm sitting here now and Ruby's talking, and I remember my sister dying and my mother dying, and then I break down on this set, tell me what this does to the public.
Wait, hold it right there. We have to go to a break, but we'll be right back after these.